It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you're doing well on this very lovely day. We have a very, very interesting program lined up for you today. In a little bit, it will be time for our weekly Brain Boost. We'll be speaking with Dr. Dean Sutherland, who is a neurologist here on the Sun Coast, and we're going to talk about SSRIs. These are medications that are sometimes given to people who are struggling with depression or anxiety. But, you know, there are a lot of myths surrounding them, and some people automatically say, well, that's a very slippery slope to start taking antidepressants. Is it? And in what circumstances would that be a slippery slope? We're going to find out. We are going to speak with Dean about the myths surrounding SSRIs. That's coming up later in the program. But we are going to start out talking about skincare. You know, your skin is one of the largest organs that you have, but it's the one that you don't think about taking care of, or maybe you care for it the least. You're doing some exercising and eating right to maintain your heart health and brain health and a good vascular system. But what are you doing for your skin? Well, we are going to find out about some of the hot trends in skincare. We're going to speak with aesthetic dermatologist Dr. Manjula Jegasothy. She's Harvard and Yale trained, and she's a frequent guest on the program. Welcome to the show, Manjula.
How are you, Heidi? Thank you for having me on your show.
I'm so glad that you're here. And, you know, everybody knows you're the founder of the Miami Skin Institute. And we've talked lots of times about some of the hot trends going on right now in dermatology. And before we went on the air, you were telling me about hyaluronic acid and the use of hyaluronic acid in skincare. And I have to tell you, I have not heard about this. So this is new to me. Maybe it'll be new to other people too. And I think of hyaluronic acid as what we're injecting into knees sometimes for therapy. Tell us a little bit about it.
Yeah, it's funny because hyaluronic acid has been around for so long as an injectable. And so now lately it's also been around for a long time as a topical agent to put onto the skin. But what's happened recently is that the technology, it's a large molecule. It's a large molecule, and putting it into a sort of a vehicle that allows it to be penetrated into the skin. When it's a large molecule, it needs to be put into something like a nanoparticle or a microparticle, and that's what they're doing now, a lot of the skincare companies, so that it can penetrate into the skin.
And for people who aren't familiar with hyaluronic acid, tell us about it.
Hyaluronic acid is a component of normal skin, and just like collagen or elastin. And essentially, we injected, like, as you knew what the injectable hyaluronic, besides for the knee, but for the fillers, Restylane, Perlane, Juvederm, the common FDA-approved fillers are all hyaluronic acid.
Mm-hmm, mm-hmm. But you think of it being injected. You don't really think of it as a topical. So you're saying it's been used for a while,
right? It's been as long as they've been available as an injectable. It's been available as a topical, except the molecule couldn't penetrate into the skin, and now we have technology.
Okay, so that's the big change because hyaluronic acid in the joints, it's sort of like a oil, to keep the machine going. And
exactly, and it's the same. It's a lubricant in the skin, and it's one of the best lubricants. It attracts water. It attracts water really well, and so essentially that's something that will make the skin cells look plump and look hydrated and look younger, I guess.
Sure.
And it's kind of what we're trying to do deeper in the dermis when we inject, and then when we put it topically, it does it more superficially in the dermis.
Yeah, I love that description using the word plump, because you can just get that picture of plumping up the skin. So
and it, like I said, it's a component of normal skin. So what it does is that's what, when you're younger, you have more of it, and your skin is hydrated and smooth and all that. And as you get older, just like you lose collagen, you lose elastin, and you lose hyaluronic acid. And so using it topically is wonderful to to do that, and the issue was always penetration, and now we have some really good skin creams that penetrate.
Now, are these the kinds of creams that you can just go into a drugstore and buy?
I would say if you look for the word hyaluronic acid in a microencapsulated form, or in a nanoparticle, or in a microparticle, then you're going to get something that penetrates. If you want to be absolutely sure, you definitely can Google. I've told you about in the past about some really good skincare online portals where they sell doctor strength hyaluronic acid topicals and all kinds of other topicals. And if you go to one of those, they will definitely be ones that have studies that prove penetration. Mm-hmm. So if you're wondering what you get at the drugstore is going to penetrate, look for the words microparticle, look for the words nanoparticle. They're going to be more likely to penetrate. And then if you're confused and you don't know what to do online, Google it through a board-certified aesthetic dermatologist website.
Okay, so I'm hooked. I just wrote down microparticle and nanoparticle, and I'll take my list and go into the drugstore and hunt around. But who should be using hyaluronic acid? Is there anyone who is not a candidate for it?
No, because it's really good even in sensitive skin.
Do we know if there are any side effects?
There are no side effects because, like I said, it's a component of normal skin. You want it all to be sourced from synthetic sources, not from I don't know of any in the United States that are sourced from, for example, from pig skin or bovine skin. But you don't want that. You want it to be made, in a laboratory. And other than that, it's very safe.
Okay, but so no side effects and anyone can use it. At what age does it start benefiting women to use this? And men, too?
As soon as in my opinion, I started feeling like I had dryness around my eye area since in college. So, whenever you start using an eye cream, and I recommend doing that when you're in your early 20s. So I think it would be wise to use a hyaluronic acid cream at least just around your eye area, so that area stays plump and rejuvenated and doesn't age. Because I always say that on your radio show too, that it's the first place that ages. And
right.
So if you use a nice, like we call it HA, hyaluronic acid, HA gel or cream in that area, it's going to delay your needing Botox and other things as you get older.
Now, is that something that you would apply in the daytime, or is it only nighttime?
It can be both.
Wow. Okay.
It's a lot of them are a really nice base upon which to put makeup.
What about prices, though? I mean, if this is something you can buy in the drugstore, it can't be too expensive,
No,
right?
It's not that expensive. It's not even that expensive in our offices because the ingredient itself is a lot less expensive than, for example, a topical vitamin C or a topical retinol. Those ingredients by themselves, just the powder or the serum form of them, are very expensive, and hyaluronic acid is not. So therefore, the cream itself should never be that expensive. I suspect that there are a lot of very expensive creams that are in the department stores that have just hyaluronic acid as their base, and they sell them for a lot of money because they don't tell us. They have, patented matrixyl or patented, made-up word, and it's probably just hyaluronic acid.
Okay, so again, the big news is that they've changed the size of the molecule of hyaluronic acid that is in moisturizer. And
Correct.
So now if you look for a microparticle or nanoparticle of hyaluronic acid in a moisturizer, then you have a better chance that it will penetrate the skin and plump up the skin.
Yes.
Very exciting. Okay. I just love it when you come on and tell us about these cool trends. So we want to find out about more of them. And everybody listening, Mother's Day is coming up. If you're thinking about what to get Mom, maybe a nice little basket and tuck one of those babies in there. She'll probably like that. And we want to find out more, but we need to take a quick break. So everybody stick around. More with Dr. Manjula Jegasothy, founder of the Miami Skin Institute and aesthetic dermatologist. But first, a quick break. This is Health Check with Heidi Godman on WSRQ. Stay with us. Welcome back to Health Check. I'm Heidi Godman. We are talking today with my friend Dr. Manjula Jegasothy, who's an aesthetic dermatologist, founder of the Miami Skin Institute over on the gorgeous east coast of Florida. But we are here on the west coast of Florida, and we get to talk to her and find out about the hottest trends in skincare. Are you taking good care of your skin? And of course, when we're speaking with Manjula, often we speak about all parts of the body, but today especially we are focusing on the face. So we were just talking about very interesting new creams. They are hyaluronic moisturizers with hyaluronic acid in them, which have been around for a while, but they never really took off because the particles were a little too big to be absorbed. Now Manjula was telling us that these nano or microparticles of hyaluronic acid are so small that they can be absorbed by your skin, plump it up. So that's good news. And now we're going to talk to Manjula about using low-level LEDs as a complementary therapy to different sorts of treatments to make your skin better. So microdermabrasion and different things like that. And Manjula, I'm thinking of low-level LED lights as, something in my television.
Yes, so it's these new lights are sometimes in office procedures, but you can actually buy them online too. And they've been popular with skincare specialists for a long time. A lot of facialists will shine a light on your face while they're either extracting or they're putting on a mask or something like that to help it penetrate. But now, lately in the dermatologic community, there's been a lot of medical literature to show that indeed it does help wound healing, and it helps stimulate collagen growth, and it also helps any topical agent that you put on the face to penetrate better. So this light is stronger than your TV light or your living room lamp, but it's much less than a laser. So there's no real downtime from it, and it doesn't feel painful or hot or anything like that. And it's shown directly on the face for about 15 minutes. It's at a level that doesn't have any actual significant UV radiation either.
But what would it do?
Again, they've shown that this kind of light actually it stimulates. It opens the pores so that, and I think the pores are light sensitive, and that's something we're finding in the studies. And then we think that stimulates the pores to open, and then create better channels for topical products to penetrate. And then we also think there's some sort of increased collagen production, and the mechanism of that we haven't. It's all that's been shown in the studies is that there is more collagen production. We don't know why.
All right. So is this something that you only find in a doctor's office? One of these?
Not at all. In fact,
really?
Yes, they were originally sold over the counter, and I think even in the 60s, 70s, it was I think it was more popular kind of to try and get a tan. But
yeah, now I can remember those types of lights.
Right. So these are just one wavelength, like just a red wavelength or just a blue wavelength, and they've been kind of sitting around since those tanning days, forever, and looking for a home, I think. And so now, for about 10 years or so, facialists have been using them. So they're in the salon industry, and now you can buy them, the medical version of them, from companies like Tria, TRIA. That's the company that also sells the home laser hair removal machine, and also the home IPL, intense pulse light, which is like a light that removes photo damage, sun damage, like brown spots. So they also sell this low-level LED, so you can get a medical version online.
I'm kind of, scared just hearing you talk about these things, all these different types of machines that you can buy and then use at home. I don't think I'd want to attempt it. Is it really safe for someone to buy something like this and just try it at home, just reading directions?
I think are such low level energy that I think your microwave puts out more energy than that. So I think they're safe. They've all been available the Tria company has put out these products for more than 5 years now, and there've been no documented burns or anything like that. So I think they're safer than hoverboards, for example.
That's especially the hoverboards that explode when you try and charge them. Okay, so, and which is not, we don't want to laugh about it. We just want to warn people, be careful.
We're not laughing.
We're just, we're shaking our heads about it. So maybe you could buy one of these things and use it at home, or you can always go to a dermatologist's office or to your esthetician and talk about the low-level LED. Do you use it before you get a treatment or after?
It's immediately after. So sometimes it's even during, sort of. So they might, facialists might put on, do a little mask, and then while the mask is drying, they put the light on your face. We typically can do it. We sometimes do it when we put on a chemical peel. Right after we take the peel off, we'll put on a vitamin C serum or some retinol, or even after Fraxel laser, and then we put on the light to help it penetrate better.
Okay, so the light just helps it penetrate better. And then it might be used if you've had one of these treatments. And what about with microdermabrasion? Because that seems like it would be a little like adding insult to injury. Am I wrong? Or is it more effective to use the LED?
I think it's soothing, actually.
Really?
Yeah, so that's part of it, too, is that I think that red light and the blue lights are soothing to the skin.
Okay. So you can ask your doctor, your facialist, your esthetician about that, or if you are brave enough, then you can just go ahead and buy the equipment for your own use. How often?
I think the key is that I'm not sure they do a whole lot just by themselves. It has to be in conjunction with putting on, and you can do that at home, is put on a vitamin C serum or put on a mask and then put this on.
Okay. And you've brought up vitamin C serum a couple of times, and you and I have talked about that before, but I'm just thinking maybe we have some listeners who aren't really familiar with that. So let's switch gears a little and talk about vitamin C serum, because that is really a hot topic in the world of skincare now, isn't it?
Yes, vitamin C has always been considered great to take internally for all kinds of reasons, and if you're deficient in it, you get a disease called scurvy, where you actually get open sores and your blood vessels break more easily, and you get bruises. So vitamin C is crucial to almost all of our soft tissues and even our internal organs. So now, topical vitamin C, for a long time, it was difficult to get it to be stable in a cream or serum formulation, and then B, to get it to penetrate. And so now, it's become really popular because there's a few different brands that really have proven very well that they not only are stable in the bottle, but they're also great. They're good penetrators and have been shown to grow collagen.
Yeah, so that's what I was going to ask you. Number one, do they really penetrate? Because we were talking about hyaluronic acid, and previously it wasn't really penetrating the skin. Now we have molecules small enough that they do. So vitamin C does penetrate the skin well?
Yes. So vitamin C, the penetration factor was often that the pH was too high. Vitamin C is only stable at a fairly low acidic pH, and so it needed to be in formulations that were acidic without being too irritating to the skin. And so that's what companies like SkinCeuticals or Obagi or Neocutis have now kind of perfected. The drugstore vitamin Cs, I will say, I haven't seen studies as to their penetration effectiveness. I can't comment on those, but I can comment on these physician dispensed brands because they have studies showing that.
Okay, and then how does it work? What is vitamin C doing when we put it on the skin?
Vitamin C is a known cofactor, meaning it is essential in the enzyme reaction that actually produces collagen from its molecules, from its parent molecules. Collagen is a rather complex helical molecule, much like DNA, composed of a lot of different proteins, and vitamin C connects them.
Okay, so then when vitamin C connects them, what happens?
When vitamin C connects them, you have more collagen in your skin. So therefore, your skin gets actually physically thicker, which is great because we all know that the skin thins as you get older. It also smooths out uneven surfaces in the dermis, so the skin looks smoother and less wrinkled, and it actually fills in fine lines.
Okay, so this is great for anti-aging and maintaining your skin's appearance. Well, what about your skin's health? Is it making the skin healthier?
I think probably in terms of making it healthier, and sure, the more collagen you have, the healthier your skin is. I mean, healthy skin is sort of, as we get older, there's a sort of different different endpoints as to what is healthy skin. You know, you can't have, at 80, you can't have the skin you had at 20. So, and that's because intrinsically the cells just don't work as well. It's like the car needs new parts. So the cells don't work as well as they used to. And so these things kind of boost cells into working a little bit better.
Mm-hmm.
And that's the best we can hope for right now. But hopefully in the future we'll be having things where we can actually inject 20-year-old cells into someone's skin, and then that would really do the trick.
That'll be a fun show to do. Oh, I can't wait for when we have that headline one day. Okay, so this is encouraging. So vitamin C can plump up your skin a little bit if it can help boost your healthy collagen production. And then can you use all these things together? We were talking about the hyaluronic moisturizer and now vitamin C. Can you use them at the same time?
Absolutely. You know, my favorite regimen is a glycolic acid cleanser to exfoliate the dead skin cells, and then a vitamin C serum in the morning, which often acts as a nice base to then put on your makeup over without being too oily, and then using a retinol cream, which might be a little bit heavier at night.
Okay. All right. And you're saying that we should probably go for the vitamin C serums that are professional strength. But when it comes to the hyaluronic acid, it's okay to look for those in any drugstore as long as you're looking for the words microparticle or nanoparticle.
Correct, or microencapsulated, something like that.
Okay, I'm writing it all down. I hope you are too, everybody listening. This is fantastic. Okay, we want to keep talking to you, Manjula, so please stick around. And everybody, you stick around too. This is Health Check with Heidi Godman on WSRQ. More with Dr. Manjula Jegasothy, founder of the Miami Skin Institute, in just a second. Stay with us, please. Welcome back to Health Check. I'm Heidi Godman. We have been talking today about skin health. It's been a lot of fun, and we are going to keep on talking about it in terms of things that you can do at home to make some minor corrections. And I have to tell you, I was on television for 25 years, and in that time, you learn a makeup trick or two. Well, guess who else knows all about these? Dermatologists. So we are going to be talking now about things you can do with makeup colors to fix some of those imperfections in your face. And my guest is Dr. Manjula Jegasothy. She's a Harvard and Yale trained aesthetic dermatologist, founder of the Miami Skin Institute. We've been having a lot of fun talking about some hot trends in skincare. But now, Manjula, let's talk about some of these little tips and secrets that we know that we can share, because there have been some real breakthroughs in the market, just makeups that you can buy.
Absolutely. Let me turn it around for a second on you, though. I've been. You told me you've been on TV for a long time. Did you know for a long time about how green hides pimples and red spots?
Oh yeah, of course.
So, what green products did you use in the past, or what's a TV trick for me? I'm curious.
A TV trick for you?
Yes.
A TV trick for you. I didn't know. You are so gorgeous, Manjula. I don't think that I would say any trick is necessary.
I get pimples too, believe me.
You know what? I think that it part of it, I think, has to do with how much you prepare. Because if you're actually going to prepare and you know what you need to do color-wise, you always have your tools, then that's really going to make a big difference. And now, as we're talking about with these different makeup companies, they've come out with things that we can just throw in our bag and always be prepared for.
So easy. I remember that Clinique made a green stick, and that was the thing that everybody used, correct? Is that the one everybody used?
It is indeed. And then everybody started to make a green stick. But, you know, if they're too creamy or too thick, you know, if you put on too much makeup, then it gets in the cracks of every crevice of your face, and then it makes it look worse.
Right, and makes your pores look bigger.
Right. So tell us, let's talk about the different colors that some people are struggling with, and some of the products out there now. Because, you know, the red skin, I mean, pimples, sure, but also some people have red splotches on the skin. And, you know, you couldn't just put a whole big bunch of creamy green stuff on it to make it better before. But now that's changing.
Sure. Some interesting things I found from, you know, some makeup artists and, you know, sort of general sources is that the they're still using light greens and darker greens depending. If you have overall splotchiness, it's a darker green. If you have a very specific red zit or broken capillary, it's like a light green. And then they're also saying now for dark circles, depending on your underlying skin tone, use a yellow, orange, or peach underneath your concealer to cover the dark circles.
Yeah, and
that was fascinating.
To me, that is something from television that we all learned so early on. You do not want to put a concealer that is lighter than your skin on your dark circle because it makes it pop out.
Correct, and a lot of us who aren't on TV don't know that. So this was all news to me, so I thought this was great. The other thing is purple, light purple, lavenders, and even maybe light purple blues brighten general sallowness when applied in a very thin layer underneath your makeup.
Mm-hmm. Okay, so you can find these things now very easily, and you know about some of these products that are available now. Tell us about those.
Yes, I actually like Smashbox has a bunch of pencils that are these different colors, and they're very light, so you can put them on sort of heavier on a single area, or you can kind of lightly paint them and then sort of blend them in with your fingers on your whole face. And Marc Jacobs has a whole line of them where you get all the colors in one stick, much like a deodorant type stick, and then you use a brush to put each different color on each part of your face that you need it. So you're really only carrying one product around, which I think is nice.
Yeah, and you don't necessarily have to go to the makeup counter in an expensive department store. You can go to just a simple makeup store like Sephora or something like that, right?
Yes. So Sephora has a line they're calling the Bright Future Color Correctors. By the way, this whole line of makeup that's kind of new is called Color Correctors, just so you know.
Okay.
And so the Sephora collection, they look very much like lip glosses, and they're between $10 and $15 each, and they have all shades of greens, all shades of peach and yellow and tangerine, and then they have all shades of light purple and blue for sallowness, and it's very much like a lip gloss, except that the applicator is a brush.
Okay, so these are really great quick fixes, but they're not intended for a long-term fix, because if you have dark circles, or if you're always sallow, or if you have reddish blotches, you might really benefit from something that's more of a long-term fix. And are people coming to you as a dermatologist and saying, gosh, what can I do about this that's permanent?
Absolutely. Especially in Miami or anywhere in Florida, it's so hot. You can't wear so much makeup all day long. It drips off your face, you're sweating, etc. So, my goal always with all of my patients, no matter what their age is that I'm trying to get your skin to a point, whatever that takes, that you don't need to wear much makeup on a daily basis. Really nothing at all, except maybe a little powder and then whatever eye makeup and lip makeup you want to wear, but, whatever color, but not so much that you have to cover your skin every single day. Sure, on a big night out or whatever, you can, if you want to go out, then you can get a little more coverage and a little bit more concealing. But so, we use lasers to fix the under eye circles, the Fraxel most notably. We do the color correcting lasers, which is the intense pulse light or the V-beam to correct sun damaged brown spots and sun damaged broken capillaries or rosacea. And then, just for overall skin sort of to homogenize the complexion, light chemical peels are great for that.
Okay. All right. So there are a lot of things that you can do for that. But what about sallowness? Is that something that can be fixed?
I think sallowness, this is the one where everybody thinks they need to go out in the sun to improve sallowness. But, I think that everybody also thinks they need a bronzer. Everyone thinks they need a bronzer, and what they really need is a light purple and, blue to go under their makeup, and then maybe use a bronzer type of makeup. Now, in terms of me fixing sallowness, I think that's about what you said before, overall skin health. If you're producing good collagen and you're getting enough sleep and you're hydrating and drinking enough water, you won't be sallow.
Yeah, that's what I was just going to ask you. Are any of these colors that you might be seeing on your face, are they really an indication that something's wrong? You know, if you have the dark circles, if you are sallow, if you have a lot of red blotches.
I think that's such an individual question. Some people have dark circles and they get 10 hours of sleep a night. Some people, never go out in the sun, and so they're a little bit sallow. And so those people, I don't blame them, because that's what I want them to not get too much sun. So, I tell them, just make sure you're eating healthy and you're getting enough vitamin D, taking it by mouth, and then you won't be sallow.
All right.
I think that some of that sallowness from not getting the sun is probably vitamin D related.
Mm-hmm. All right. But this doesn't mean that we want you to go out into the sun unprotected, as you're saying.
Exactly.
So because you could also take a vitamin D supplement. And I think that you can take, one agency recommends 400 IU, one recommends 600, one recommends 800 IU. So it just depends on your individual needs. You got to talk to your doctor.
I think it depends on your levels, because I get my levels checked once a year with my primary care doctor, who is also my gynecologist, and she has me check them, and mine are very low most of the time because I never get sun, so I take 800. But if they're not so low, you can definitely get by with 400.
Everybody's so low. Everybody has low vitamin D, even though we live in Florida. And I'm wondering, are the vitamin D levels that are set as too high or too low?
Too high?
Do we need to change those? I don't know. That's another conversation. That's another show. I want to thank you so much for coming on and giving us the latest in these skin trends, and it's very, very interesting and encouraging that there really is a lot that we can do ourselves, whether it's at home or whether it's going to see our dermatologist. So I want to thank you for that and your expert insider advice. Also want to find out how you are using these segments that we do, because you've been on our show quite a bit, and people can go and listen to them on our website, which is SarasotaTalkRadio.com, and on your website too. Tell us about your podcast channel.
Sure. So it's Miami Skin Institute.podomatic.com. Podomatic is a wonderful platform where you can put on radio shows such as these, and then you can listen to it later when you're working out at the gym or on your commute to work. And so you can see all of the archived, listen to all of the archived shows that Heidi and I have done over the last few months all in one place. So.
Yeah. It's a lot of fun. And you are so media savvy, too, because you have many different ways that people can find out what you're doing. Tell us about some of the others.
Sure. I try to tweet every day a skincare tip. And so a lot of the things we talk about are from my Twitter feed. I certainly Facebook what's going on in my practice, whether it's a new procedure, what's going on in our office, kind of those kinds of things, light social things, and then also new procedures. And then Pinterest is where I have all of my before and after patient galleries. So if you want to see what a particular procedure can do for you, it's going to Pinterest.com and searching Miami Skin Institute. And you don't have to be on or a member of or join any of these to see any of them. They're all open to the public.
I love before and afters, and that gives me such confidence in a doctor. So good for you for doing all that, and thank you again for sharing all of your professional advice with us. We sure appreciate it.
Oh, thank you so much for having me. It's always so much fun, Heidi.
Okay, thanks again. All right, everybody, that's Dr. Manjula Jegasothy, a Harvard and Yale trained dermatologist, aesthetic dermatologist. If you want to find out more about her and what she does, just go to her website, MiamiSkinInstitute.com. We are going to take a quick break. When we come back, it'll be time for our weekly brain boost. This is Health Check with Heidi Godman on WSRQ. Stay with us.